Class is officially in session. Welcome to Metformin 101. I'm Dominique.
And I'm Ronald, and we're both pharmacy students at the College of Pharmacy at Xavier in Louisiana.
Today, we're going to briefly tell you everything that you need to know about metformin, what it treats, what it is, how it works, and what to expect. So get out your notebooks and get ready to get schooled.
So type 2 diabetes, what is that? So the main culprit in type 2 diabetes is hyperglycemia, also known as high blood sugar, and that's going to be due to the decreased secretion of insulin or insulin resistance from the pancreas. And some symptoms you may experience with hyperglycemia to look out for is dry mouth. You can be very thirsty, you could have some blurred vision, you could have weakness, constant headaches, and you may have to frequently go to the bathroom due to frequent urination.
How do you know if you have diabetes? There's a series of tests that your physician will perform in order to confirm a diabetes diagnosis. You have your A1C test, which is a great test as it gives us an average of where your glucose has been over the past 3 months. You also have a fasting plasma glucose. That's your glucose levels before you've eaten. And then there's an oral glucose tolerance test. All of these tests are used to confirm a patient has diabetes. On the table, you'll find the different levels for a normal patient, a patient with pre-diabetes, and a patient with a diabetes diagnosis.
My doctor just diagnosed me with diabetes, and then he gave me a prescription for metformin. What is that? So metformin, or glucophage, it works by decreasing the glucose production in the liver, and it also has some secondary actions like decreasing the absorption of sugar in the intestines in your stomach, and also can increase that insulin sensitivity that's the main culprit in diabetes. This is why metformin is a mainstay of treatment in type 2 diabetes.
Well, my friend told me this drug has a lot of side effects. What can I really expect? Some side effects of metformin include diarrhea and abdominal pain, along with nausea and vomiting. These gastrointestinal side effects, or GI side effects, will subside over a few weeks. Another rare but serious side effect of metformin is lactic acidosis. In order to decrease the risk of lactic acidosis, it's important while taking this medication to avoid alcohol or to drink it in moderation.
When you pick up your metformin from the pharmacy, be sure the pharmacist counsels you on these key things. Make sure you have some food in your stomach when you're taking metformin. That may decrease some of those nasty GI side effects. Also, remember, if you're going to drink alcohol, please do it in moderation to reduce that risk of lactic acidosis. And if you're having any type of diagnostic test where it calls for contrast dye to be used, please let your doctor know because you may need to be discontinued on metformin for that. And if your doctor placed you on extended release formulation, it may leave something called a ghost tablet in your stool. This does not mean you did not absorb the medication, it's just the shell. And be sure to know about the symptoms of hypoglycemia that could come with any medication to treat type 2 diabetes. Now, we already talked about some of the symptoms of hyperglycemia, so in contrast, some of the symptoms to look out for hypoglycemia are feeling very sleepy, sweating, having a decreased pallor to your skin, being kind of dizzy or having a lack of coordination. You may feel very irritable and you're going to be extremely ravenous or hungry because you're looking for that sugar that you're lacking. So be sure to look out for these with any of your diabetic medications, including metformin. And let your doctor know if you're experiencing any of these and get urgent treatment if so.
Outside of taking your medication as prescribed, you, the patient, have a few other jobs. One is ensuring you have a yearly dilated eye exam. Another one is to inspect your feet daily, as well as have yearly foot exams by a physician. These will help monitor for diabetic complications. Also, make sure you have a regular follow-up with your physician and adhere to all appointments. Another big one is to monitor your blood glucose at home on a regular basis and keep a log. This will help you track where your blood sugar is at all times.
Well, thank y'all again so very much for listening to our diabetes educational video. We really hope you got something out of it and are now able to use your metformin with all the knowledge that you need to know. Thank you again. Bye-bye.